Eritrea has a very profound history in the field of medicine, particularly in the pharmaceutical sector. Even in the harsh times of the revolutionary struggle, the EPLF leadership managed to build a pharmaceutical plant in the trenches of Sahel. Having its very beginning in the revolutionary times, the Eritrean government, under the auspices of the Ministry of Health, embarked upon a task to establish an expanded version of the Azel Pharmaceutical plant in 1991. The planning and blueprinting, including finalizing of highly complex buildings and installation of materials, was concluded by 2003, although as every other sector was interrupted in 1998.
Eritrea had a reason to start this pharmaceutical manufacturing endeavor. Although various countries have their own reasons, Eritrea had also its own unique reasons for starting pharmaceutical production. Number one, even under the most difficult situation of the Liberation War, Eritrea was unique in having its own pharmaceutical production in the field. So after 1991, the reason was why not exploit this advantage we had. So immediately we embarked on actually continuing pharmaceutical production in a new way in independent Eritrea. So the first preparations were, first of all, to construct a GMP compliant, which means good manufacturing practices compliant building that fulfills all the requirements for a modern pharmaceutical manufacturing facility. So between 1991 and 2003, the basic infrastructure for constructing the building with all its mechanical installations, with all its facilities, was made ready. And after completion of this highly complex building, the next thing to do was to find a source of know-how, that's the technology. Because now the idea was to produce medicine up to world-class standards. So we had to find the right type of pharmaceutical technology, and we had to partner with someone who can give us this kind of technology. So in 2003, we had formed a company called Azel Pharmaceutical share company in a joint venture agreement with between the government of Eritrea and a Jordanian company that's engaged in not only pharmaceutical manufacturing but in providing the know-how for pharmaceutical technology. So this was how the company came into being.
Azel established in 2003, and now it's after 10 years we are celebrating this kind of achievement which we have. In fact, the formation of the company between the Ministry of Health as one party in Eritrea and the Jordanian Pharmaceutical Manufacturing Company, which I represent, the other party, has proved a successful kind of a technology transfer between South and South, and at the same time, a kind of a strategic alliance to serve the nation, which we are practicing in Eritrea. Azel succeeded in providing the required medications for the nation, and also we are planning to advance in developing new medications as per the demands in the market.
After establishing partnership with the Jordanian pharmaceutical institution, the Azel company launched a handful of its first products in 2004. Having its principles based on ensuring availability of affordable and effective supply of medicine, Azel embarked upon a task of fighting the most prevalent diseases to affect a positive health outcome as well as for industrial and development considerations.
The main objectives for the Eritrean government as well as for the company were basically three. Number one, we want to ensure availability of affordable, effective, and medicines of assured quality. Without this, it was not possible for the country to expand its health services. So this was a very basic consideration in embarking on pharmaceutical production. Of course, the second objective was, especially for the government, to affect a positive health outcome. That means by providing the most needed medicines for the health, for the disease pattern that exists in the country, it can significantly improve the health condition of the people. So actually the company was focusing on providing the widest possible spectrum of product portfolio to fight almost the majority of diseases in Eritrea. So by providing the medicines needed, the company was able to affect a positive health outcome in Eritrea. And the last one is also to it concerns an industrial and development consideration. We cannot be very naive in that in thinking that we need only produce medicines for our own use only. The pharmaceutical production has to be sustainable. In order to be sustainable, it has to be also profitable. In order to be profitable also, it has to satisfy the conditions for successful marketing of its products. That means in marketing we call this the 4Ps or the marketing mix. They are called the product, place, promotion, and place. The product means we don't do any product. We have unique product that the customer shall prefer. Our products will have the necessary quality. They will have their unique features. Yeah, they have their unique packaging, and they must be recognizable by the customer. So the company produces unique products or brands, and these are, we call them branded generic pharmaceutical products. in fact, it has accomplished them very successfully. And that was why we had to celebrate also our 10th anniversary last week. For the factor of effective quality medicines, this was assured by our partnership with the Jordanian pharmaceutical manufacturing company, which is known for its high quality product, dossiers, the transfer of the technology, and these were actually recognized in the Middle East, in Africa, as of very high quality. So the quality factor was assured by this, and we were providing also the right prices for our Eritrean customers. That's mostly it is government provided health. So we were able to provide affordable medicines that the people can afford to buy. And also because we were successful also in our operations, we were able to sustain ourselves. So we have a continuous flow, sustainable flow of pharmaceuticals, which are affordable and of assured quality. And for the second factor, of course, we are producing from the Eritrean national list of drugs. These type of medicines are focused on fighting the most prevalent diseases in Eritrea, and by responding to the government's demands for pharmaceuticals, actually, we were able to satisfy the health needs of our people. And the third factor was actually fulfilled through our employment of more than 270 workers. The pharmaceutical sector is known for its knowledge-based operations, and the manpower needed is extremely highly skilled. And by employing this number of very highly skilled people who support their families, we have provided very good job opportunities. And we are also influencing, we are also buying, sourcing some of our inputs from inside the country, and we are also contributing to the regional economy by positively influencing many supporting industries in Eritrea.
When we first set foot in the Azel Pharmaceutical company in Keren, we were escorted to the Quality Control Unit, which is in charge of sampling, testing, and release of incoming processed materials.
Quality control department here in Azel Pharma and elsewhere in any pharmaceutical company is responsible for the sampling, testing, and the release or rejection of all incoming starting materials, in processed products and finished products, and on top of that, also on stability of the products. It's the main task of the quality control department. Yeah, together with other departments, particularly the production departments, hand in hand, the quality control department has also gone through several stages to meet all the required demand as it is a service provider to the production department, and to fulfill all the required tests for certain materials, in processed products and finished products. Much effort has been done by the company to fulfill all the required materials, tools, and instruments and equipment for the department. And time after time, several equipments have been purchased. And As far as the quality of our products is concerned, satisfactory.
I'm an analyst. I am graduate in chemistry, and I'm working here as an analyst here in this company.
What do you analyze, for instance?
We analyze for all the products here. For example, this is a dissolution tester. We check the dissolution ability of the tablets here, and we measure it through the spectrophotometer. And it is a spectrophotometer, like its name indicates, measure the concentration of the ingredients in the tablets by lights. We measure the absorbance, and the detector tells us here it is a software. It compiles us. We know the graphs and we know the amount that absorb the light. And that's all about the dissolution test.
I've been working here for almost 3 years now, and I'm working as an analyst. And now I'm currently working as supervisor of starting and packaging materials. This is an FTIR machine. It uses an IR radiation, just like the UV light. UV light is used UV light. This is an IR machine. This is a sample holder. It's mainly used as an identification test. In chemistry, it is used as an identification, for identification. So what it will do is, when we have a material, it comes, we have a sample, and there is a standard called standard. The standard is used for comparing the sample. So what we do here is we compare it with the standard, and we know that the sample is what we say that the sample is. All right? So we have a standard here. Just we call it, this is the sulfur methoxazole standard. It is used for bacterium, or we call it in Azel Airtrain. So this sulfur standard have this radiation. This is a picture of it. This is called the functional group, and when we put it in the IR, it gives us just like this one. All right? So this is the structure.
What does this bar show?
Yeah, this is structure of the sulfur methoxazole. In chemistry, that have OH, acetic acid. It have a different functional groups. So this is the reading of all the functional groups that gives us. And this is a sample that comes to us.
Okay, my name is Dawit Brhan, and I'm working here as a pharmaceutical analyst in quality control. And I'm assigned or working in the stability and validation section of the quality control. This department mainly focuses on the analysis of the pharmaceutical products that focus on the expiration dating and the storage condition of the pharmaceutical finished products. Yeah, I'm working more than 2.5 years and to see the development of this pharmaceutical industry in this short course. It is just, I can say, it's boosting all the important equipments that are available on the market at this time are also available in our industry. It's equipped with all necessary equipments that enable us to perform the necessary criteria of the pharmaceutical industry.
Having its supply of raw chemicals in its very enormous storage of supplies, the next section we went is the production room, which by itself is divided between the solid and liquid production as well as the antibiotics section.
By professions, I am a pharmacist, and I have been here in this company since beginning of 2005, and I'm responsible for the all-over activity of the production departments. So this productions is the area where different dosage forms are being produced, and currently we are able to produce around 53 types of products. And the production department or section has 3 major production lines. The solid lines, which is responsible for the manufacturing of tablets, capsules, and ORS. And our potentials or capacity is huge in this solid line, as you saw it. Particularly the ORS sachet line, acute chronic diarrheal disease, one of the leading cause of for infants and children under 5 years old because of dehydrations. But this company is able to produce huge capacity of ORS. We have the European standards machinery of ORS sacheting machines, which can be able to produce as much as possible ORS. The other line is the liquid sections, which is dedicated for the productions of syrup and suspensions. And the other line is the antibiotic sections, which is responsible for the productions of antibiotic capsules and dry powder suspensions.
In this unit, we prepare a liquid dosage form. We prepared according to the manufacturing formula and processing instruction with the help of BMR, which means batch manufacturing record. The cleaning and operation of the machine carried out through the SOP, which means standard operating procedure. In this liquid dosage form, we prepare about 10 liquid products, some suspension. There are 2 metronidazole suspension and azathioprine suspension. The remain are syrup.
My name is Nahom Sae. I am a biotechnologist, and at this stage I'm working as a unit supervisor of the secondary and primary packaging. When we say this primary packaging, it's nothing but the bottle filling process that you have observed a little earlier before. And here we are in the packaging and labeling area. They are labeling the syrup because if you didn't label the syrup, it's hard to identify which is which. And those guys are labeling the bottles, and these guys are packaging the bottles in the secondary bottle so that we can deliver it. We deliver with that gate, a finished delivery product. That means for us, it's the last process, but for the storing purpose, after checking for a little while, it's going to go to the market.
Well, the part I can say about the production department, when I joined this company in 2005, the number of employees were very few. Very few, around 20 employees. But now we are already 113 employees are engaged in productions. And our number of the employees are increasing hugely. Not only in numbers, but in diversity of professionals. Pharmacy technician, chemical engineers, Hamam's graduates are contributing hugely both in manufacturing and the packaging lines. In terms of manpower, we are almost, double or triples. At the same time, the capital investments, the company is investing hugely in the states of art machinery and equipment, as you already seen it. We have state-of-the-art new automatic machineries. So in these 2 aspects, we are increasing hugely, and at the same time, the number of products since 2005 are increasing hugely, both in quality and quantity.
This line is just part of the production. It is located here. because the nature of antibiotics, beta-lactam antibiotics, highly sensitizing, and to avoid this cross-contamination, it is located here, and of course, the air handling system, everything is different from that of the main production area. Apart from this, it is just similar to that of the production. What is produced here is amoxicillin from this beta-lactam antibiotics, and we have 4 strengths of amoxicillin, amoxicillin 500 milligram capsule, amoxicillin 250 milligram capsules, and of course dry powder for suspension 250 milligram per 5 ml and 125 milligram per 5 ml. As we have seen earlier, the machines that we are having are modern and they can produce enough amount of these products for the community, and we have witnessed in the last 2 years. This amoxicillin is broad spectrum antibiotic, as we know, and many of the infections that we are having, that is pneumonia, common cold, sore throat, UTI infections, all are curable with this amoxicillin, being broad spectrum. So, we have seen that the prevalence of these infections that I have been mentioning are highly prevalent in our country. So, it's highly contributing to the health of the public.
Well, when we started, actually the production started in 2004 with a handful of products. This was actually to introduce the products into the Eritrean market, and this was significantly growing year by year according to the responses of our customers. And now, at this period, we are producing 56 different types of products in different dosage forms. That is from tablets to capsules, from liquids, that's the syrups, into powders packed in bottles, and also into sachets. And now we are also planning to introduce the antiseptic solutions for hospitals, and recently we have also introduced dry powder for suspension of antibiotics. So actually the number of products keep growing, and the production lines also keep growing.
The most amazing part in AZEL is not only the world-class machineries, but also the human resource personnel or the working force, which are keen to being compatible with the state-of-the-art equipments.
The human resource at AZEL is high on the agenda, and this is for various reasons. You may put in infrastructure, bring in machines, computerized machines, but at the end of the day, it will take human power, skilled human power, to exploit that and obtain the required result. So for that reason, human resource is high on the agenda, and we can talk about the capacity building, for example. This comes in different forms. As new employees, every employee is required to go through a training that's called GMP, or General Manufacturing Practice. That's for starters. But after that, there are targeted trainings provided by in-house capacity, for example. There are trainings that are given by consultants from outside, especially on the managerial aspect. There are also trainings that the company pays for, like through formal educational institutions. It will be at home, or at least in one case, there are at the moment 4 department managers who are pursuing their MBA in England, or I mean through correspondence. And this is only the beginning. And then there is for on-the-job training, AZEL sends some of its staff to our partner JPM, Jordanian Pharmaceutical Manufacturing in Amman, and there people have been trained on the job in running a company like that, for example, or some are sent to attend workshops relevant to the task of manufacturing medicine. So in all aspects, human resource, or the company invests so much and cares about its human resource, not only because it wants to help, but its objective can only be met through a committed staff, satisfied staff, and the commitment can only come through caring. So that's how I can briefly express.
Actually, our employees, most of them, they are pharmacists, chemists, and chemical engineers. Right after they come out of the college, they have to go through a training session here in AZEL Pharma, so that they will be capable of doing the required tests. The training session has to continue for 6 months at least, so that they will be capable of doing the analytical activities here. I believe the colleges also, they are doing their best to make them competent, not only for AZEL Pharma, even for other companies also. But they are good, and we are doing our best to equip them with all available materials so that they will be able to do their work here efficiently.
Well, we are trying to provide an house training for our employees in order to work their jobs in a proper and professional mannerisms. So these departments are hugely involved in giving trainings to the employees, because machinery cannot be done without having a qualified employees. So with these respects, our employees are able to run the machines in the way that the manufacturers are recommended. So we are doing a very great job in running these state-of-art machineries.
When sent here, the finished products, which have come to meet 35% of the pharmaceutical demands in Eritrea, are discharged from the Pharmacore Eritrea.
Now we are preoccupied with expanding our market. The Eritrean market in itself is not big unless we expand our market into the region. And by this, it means we will be more sustainable, profitable, and will be keeping growing and satisfying the needs of Eritrea, health-wise and in the economic sense also. So exporting is now our main preoccupation. But exporting is a very, very difficult job, because, especially with pharmaceuticals, because pharmaceuticals are heavily regulated by health authorities in different countries. You have to satisfy the requirements of the various standards and regulations. So in each country where we want to go, we are submitting our scientific or product dossiers for registration, and after obtaining the marketing authorization in country by country, then we intend to be able to penetrate markets one by one. So now our main challenge is to find markets for our products abroad.